Hello there. This week we're going to talk about knee injuries. Knee injuries affect many people, and the reason for that is that many people have knees that are not aligned. They're not lined up properly. So what that means is that if you were to look at my kneecap, many times you will see that the knee rotates inward. Now that imbalance originates in the feet. So therefore, going back to what we've said many times, is that custom orthotics will help to align that knee in a much better position. If you don't do that, then you may start to experience knee pain. And if you experience it on one side, that's telling you that your body is imbalanced because you're doing a repetitive symmetrical activity. Why is it only occurring on one side? Now, the traditional thinking is take a painkiller, take an anti-inflammatory, and hope that it goes away. And that's an illogical approach because you want to find the cause of the problem. So if there is an imbalance either in the foot or in the knee, that's going to contribute to why that knee hurts. Likewise, if there's a leg length difference, you're going to have more stress going through one side of the body than the other. And the body's response to that, it doesn't matter where it is inflammation and pain. So if you start to experience inflammation and pain, odds are good you have an imbalance in your body. And we would always recommend going back to the first recommendation, which is to have a structural fingerprint exam and learn what your biomechanics is all about. At home, you can apply ice on it. You can give it rest. You can do alternative exercises. The ice is 15 minutes at a time, multiple times per day. But with a knee injury, it can be due to a patella tendon, it can be due to a bursitis, it can be due to a meniscus tear, a ligament sprain. There's a variety of causes, and very often we'll have to x-ray it, and often we'll have to take an MRI to determine what's causing it. In many cases, you may end up with surgery to have the knee scoped to clean up those meniscus. If you have to, you have to. But the imbalances we have in our life and the neglect to our musculoskeletal system, which is, epidemic in our country, we end up with knee issues because the knees are under such stress over time. And now with running, the repetitive symmetrical motion that you have going on, very often the knee will be your first warning signal that something's not right. So again, custom orthotics is a first step in the right direction. Icing it will help to bring it down. Proteolytic enzymes, the all-natural anti-inflammatories, but ultimately we're recommending a structural fingerprint exam and learn what your biomechanics are all about.